If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
And hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today, and this is our 15th season. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, by calling the live phone line at 718-499-6101. And second, you can email your questions to askthedoctor@netny.net, and we'll bring them into our discussion. And only for this season is the NET Viewer Survey. Now, if you haven't done so, please take the time to participate as you wait for your turn to go on the air. This survey is here because we'd like to give you the chance to officially and anonymously sound off your opinions about Ask the Doctor and NET programming in general. For those who cannot get through and are not on our mailing list, this is the address to send it to. NET at 1712 10th Avenue, Brooklyn, New York, 11215, and ask for the survey, and they'll mail it to you. Now, of course, you can participate online at netny.net. I want to thank you for that. Also, at the beginning of the season, we had big interest over our limited edition t-shirts. Remember, we gave it out to some of the winners of the contest, and these were lung t-shirts. Now they're all gone. Now we have heart t-shirts, and look, I have something. It's magnificent. I love this shirt. What do you? Look at that. So this is a heart shirt. It says, "Be proactive, ask the doctor." And this is a limited edition. This is not being made. Once it's sold out, you don't get it again. And what we're going to do now, if you pledge $60 to the NET, we're going to send you this limited edition t-shirt. Free. So $60. This is, first we did the lungs, then the heart. We keep going down the body. I suggest you get in now before we get into the colon because, you know, it's better to wear the heart shirt, I think. Anyway, so call in tonight and reserve your shirts, and we're going to mail them to you as soon as we receive the payment. Not that we don't trust you, but we want to get that payment first. And as always, thank you. Now, for this episode, we have Dr. Ronald Suave. He's the chief of podiatry at the New York Methodist Hospital. Then we have Dr. Jeremiah Gellis. He's cardiology attending at New York Methodist Hospital. And then Dr. Ramin Mirastami, pulmonary and internal medicine attending at New York Methodist Hospital. So we go from head to toe tonight with your questions. And I think we'll get right to the news because we've assembled this stellar panel. I already see the phone lines are going crazy. So let's just review quickly in the news. The first one I entitled, "Wash That Shampoo Right Out of Your Baby's Hair." And what this is about is a consumer group is urging Johnson & Johnson to remove two of the chemicals that are in the baby shampoo, which they feel are carcinogenic or cancer-forming. One of the chemicals is quaternium-15, and the other one is dioxane. And I suggest you take a look and see if it's on the shampoo that you're using to do your baby's hair. Hopefully Johnson & Johnson is going to withdraw this, although they argue that it's not carcinogenic. So there's a little dispute there. But I have a feeling they're going in direction to take these particles out. So speak to your doctor about it, see if it's right for your baby's hair, and then you decide. Second, breast cancer family history may not be as much to worry as we had thought when it comes to BRCA. Now, if you do have the BRCA, which is the breast cancer gene, it's an abnormal gene, then there's a 5 to 20 times increase that you're going to get cancer in your lifetime. But if your mother had this gene and you didn't develop this gene or you weren't given this gene when you were born, then you don't have any increased risk, which is good because not everybody whose mother had the breast cancer gene will have breast cancer. And it really put a crimp in the lifestyle, having to go for extra screening tests and procedures which weren't necessary. So you want to check that out. If your mother has breast cancer positive gene and you don't have it, then you don't have an increased risk for cancer. Now, time after time, I don't know how many of you guys have been on weight loss programs and so on, and what happens is easy. You knock 20, 30 pounds off, you kill yourself, you're exercising, only to see it come back. And people getting really frustrated. Is it because I'm not, stick-to-itiveness, my habits, I'm not a good person, all these things. Turns out a study came out last week that showed that there are hormones that make your appetite increase, make you want to eat. One of them is called ghrelin, and the other one is called leptin. And these hormones actually are very strong drives to your eating. And as soon as your weight hits a certain point, they kick off. And you don't have a lot of control over it. I mean, you want to take control of your actions, but you do have this tough thing working against you. The key is now scientists are working to develop medication that will inactivate these hormones. And this may allow people to stay healthy and stay at a healthy weight. In the meantime, they're talking about increase of the surgery to reduce the size of the stomach and hopefully to lose weight that way. And they're going to lower. Right now you have to be 100 pounds overweight. They're considering lowering that weight to 50 pounds, and that may be an answer. But I think the real answer is going to be when we can develop this anti-hormone pill. And, you know, similar to diabetes is a hormonal problem. You don't have control. Similar to this is the weight problem. So, and finally, sugary drinks. Really not for kids. They're a no-no for kids. And the group that brings this article up is very upset that the advertising is targeted towards the children and adolescents, particularly black and Hispanic. And it's really creating a problem because these sugary drinks have caffeine, they have sweeteners, they have the same amount of sugar as Coca-Cola. So parents who think they're doing the right thing are not really doing the right thing with this. So you want to look into sugary drinks. Why don't you look on the site and see how many calories they have and see what the ingredients are before you give it. Then we have, that's the end of our news. I see Monsignor Bennett's nodding. This is our own version of Occupy Net, because Monsignor's been here 15 seasons, missed only one show. And thank you, Monsignor, for coming and supporting us. What do you think of that story? I was surprised too. He was surprised about the amount of sugar in these drinks. I want to shout out to a loyal viewer of Ask the Doctor who I ran in the other day, Gina and Patricia Blumette, who were very nice, and ran into them in Park Slope, and it's nice to have you on the show. And now we're up to the quiz part. So this is here's the all-important quiz that we give each week. Who was the only U.S. president never to have been elected president or vice president? Who was the only U.S. president never to have been elected president or vice president? The number to call with your answer is 718-499-6101. And remember, tonight's topics are foot surgery, cardiology, lungs, and internal medicine. And remember, you can also email us your questions to askthedoctor@netny.net. And please take our survey, okay? We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And we're back. Welcome back to Ask the Doctor, where our topics are foot surgery, cardiology, lungs, and internal medicine. I'm still amazed at this shirt. I'm looking at this, sir. Be proactive. And then, of course, Ask the Doctor on the back. And the heart. I mean, already Dr. Gellis is looking for one of these. This is a nice looking shirt, isn't it, John?
Beautiful.
Love this shirt. Teresia, excellent job in making these up. Remember, $60, and that'll get your shirt, and will it get you right on the subway anymore? I don't know, probably. But anyway, let's meet our doctors. Dr. Suave, it's great to see you back.
Same here. It's always a pleasure coming back. I always enjoy the viewers.
That's why, and I'm always amazed at the number of calls from the feet, you know, all the problems that people encounter, because it can make your life miserable.
That's absolutely true. One of the things, because when your feet hurt, you tend to compensate and change the way your gait goes, and then other things hurt, your knees, your back, and it works your way up. And so it's important to take care of your feet because the rest will hurt from it.
Any good plans coming up for Christmas?
Well, hopefully, yeah. I'd love to have people over. We have a big Christmas family dinner and so forth.
He's not talking to the audience here. You know, you get our audience will show up at the house.
Right.
Yeah, no.
Well, I tell them, I give them your address, so it's okay.
So, no, but it's great to have you back.
It's always a pleasure.
I'm
Thank
looking
you.
forward to the questions. Thanks, Dr. Jerry Gellis. Always a pleasure to have you here. And it's good. Last time you missed, you were ill. I know we missed you on that.
Yes, I was. My wife wouldn't let me come.
You got to listen to the wife. It's important. What's going on in cardiology?
Lots of things are going on in cardiology. I guess one of the newest things is the new drugs that are replacing Coumadin for anticoagulation, for blood thinning.
Very good. So we'll get into a little bit of that and some new procedures that are going on. And It's great to have you. Any plans for you for the holidays?
I'll have to ask my wife.
Very good.
She's in charge of my social schedule.
That's good. No, you stay out of trouble that way, right? And Dr. Mirastami, it's great to see you back. This is your second appearance, right?
That's my second appearance. Yeah.
Do you have any good Christmas plans?
Family get together.
I see they're already putting decorations out. I mean, it's amazing what goes on.
Of course,
right?
they start very early, right? It's unbelievable now.
Too much. What's going on in lung disease at this time of the year?
This is the season. Lots of cough, phlegm, asthma, shortness of breath, chest pains.
So what more could you ask for? You got 3 of our best doctors here, and we're ready to take your questions. Again, I understand on the phones, we usually like to see who's the number 1 caller, who calls in first, and somehow Maddie was there, I was told, and got bumped by someone else. So we're going to still give Maddie the recognition tonight, and then let's see who bumped Maddie. Hello?
How you doing, Dr. Garner?
Who's this, Patrick?
Yes, how are you?
Patrick, what happened? How did you bump Maddie?
Yeah, I don't know how. It's probably just my lucky day.
Yeah, it's a lucky day, lucky day. How are you feeling?
I'm okay. I'm pretty good, Dr. Garner. Dr. Gellis is actually my mom's doctor. My mom's Angelina Ferraro.
Mm-hmm. Oh, very good.
Yeah,
Patrick's a loyal member.
Him and Dr. Khan, great men, very great men.
What can we do? You have a good question for us tonight?
Yeah, Dr. Khan, Dr. Garner, I have a fungus under my feet, on my both toes. Is there any way, everything I do, nothing helps it?
I want Dr. Suave to address this. Fungus under the toes. What can be done?
Is it of the nails or of the skin?
The nails, underneath the nails.
The nails. Well, believe it or not, fungal toenails is one of the hardest things to cure. But there are treatments out there. One of the reasons topical treatments alone are very hard to work because the nail is tough and it's hard to penetrate the nail. So a lot of times we use an oral medication called Lamisil. Lamisil you take for 3 months, but you monitor the blood tests, including the liver enzymes. But it's less than a 0.2% chance of any adverse effects with this medicine.
Right.
It has a 70 to 80% success rate. Lately, that's been in the news. People have been trying laser-type procedures for it. Unfortunately, it's not covered by insurance companies at this time, and still no guarantee with the results, though. But I would talk to your doctor about Lamisil if it's a chronic condition.
That's a tough problem. It's an irritating problem.
Very much so, and cosmetically, it bothers people.
So, Patrick, we hope that helped. You have an answer to our quiz tonight?
Dr. God, I just want to say one other thing.
Sure.
You heard about the plane? You heard about the plane that got stuck up in Connecticut?
I didn't hear about that one, no.
Yeah, it was on the runway for 10 hours.
Wow, I thought they were going to do away with that. Were they 2
Yeah,
hours?
well, what happened was my nephew, the one that got hurt, was on that plane.
Wow, he got hurt?
No, remember I told you he got paralyzed a few years back?
Right. He was on that plane. Wow.
He was on that plane. Yeah, it's a really bad situation we had here.
Is he home now?
He's home now, yeah.
That's good. What's his name again?
Jimmy Brown.
Jimmy Brown, we wish you well.
Thank you. The answer to the question, I think, is Lyndon Johnson.
Okay, it's good. Sounds like a good guess to me. Let's see. Is the answer to the question, who's the only president never to have been elected president or vice president? Is it Lyndon Johnson? Oh, boy. Patrick, I thought you had it. I thought you had it. So did Dr. Suave.
Okay.
All right, look.
Thanks,
Can't win every
Doc.
week.
Right.
Have a good time. Have a nice
You
week.
too.
We'll talk to you
Thank
next
you.
time. We now have Bibi. Bibi or Bibi?
I'm here.
How would you pronounce that?
Bibi.
Bibi. It's a nice name.
Thank you.
Is that short for something?
Yes,
What is that?
it's the TV.
Is it for the TV?
Yeah.
Interesting. What kind of name is that?
Oh, it's my nickname.
Which one?
It's a nickname.
Oh, nickname. Nice nickname.
Arabic. It's an Arabic name.
Arabic. Very nice. So
And-
what can we do for you tonight? Where are you calling us from?
I'm calling from Brooklyn.
Brooklyn? And what can we do for you?
I have a heart condition, and what they said, it's an enlarged heart. And as I get older, I'm getting heart palpitation.
Okay. So let's say, how old are you?
I'm 58,
58. How many pounds do you weigh?
127.
Okay. So Bibi's had heart condition. The heart's getting bigger, and she's getting palpitations now. She's 57 years old, 58 years old. Dr. Gellis.
Have you seen your doctor about it, Bibi?
Yes, I've seen 2 cardiologists, and I've took all the tests that they have to offer me. And right now, what is happening, about 6 months ago, I was in the hospital for a week because they monitor me with the Norpace, and that is not performing as the cardiologist expected. So they're suggesting that I do an open heart surgery. And that's what I want to know from the doctors tonight, what I can do, and if that's one of my options, or if I have any other options.
What kind of open heart surgery do they want to do?
What they want to do is when they open the heart, they're going to, the thick layer that's there, that's stopping the muscle or the blood from passing through the vein, they want to scrape it.
Like a pericarditis,
You think
pericardial
it's
effusion.
pericardial
Effusion, yeah.
It's very hard for me to tell exactly what's going on. You obviously have a complicated situation, and I think the most important thing for you to do is to make sure you have a good cardiologist monitoring your care, and they've done the appropriate diagnostic tests so that they're sure of exactly what's wrong with you. But it's very hard for me to interpret exactly what you're saying at this point.
Bibi, what I'd like you to do, because we do have next week we have another show with a cardiologist, ask your doctor what's the procedure, what does he want to do, and what is the name of the condition that you have. And this would make it very easy. Then we could give you opinions.
Okay, also I take the Coumadin.
No, the medication, just tell us what the condition is and what kind of surgery the doctor wants to do. Ask him those two questions. Tell him you want to get a second opinion.
Has the doctor used the word ablation?
I asked him about the ablation, and he said, she said that it's not for my condition.
Okay, well,
okay.
Yeah.
As soon as we get the name, it's going to help.
We need more information.
Okay, Bibi, so promise to call us next week?
Yes, I will.
Okay, we'll talk to you next week. Let's go to Marie now. Hi, Marie.
Yeah, hi, Dr. Garner.
How are you tonight?
Coming along, I guess.
Where are you calling us from, just so we remind people?
Brooklyn, New York, Bensonhurst.
Bensonhurst, yeah. Right. Actually, I went into a restaurant. I went into La Sorrentina.
Oh, yeah.
Nice
very
place.
Good food, huh?
I thought it was very nice.
Yes.
I actually couldn't get into Gino's. Similar to Gino's, right?
I think Sorrentino's a little better.
I liked it a lot. They've got a nice table. Any of you guys ever eaten?
Yes, I've been there.
Really nice. And they own a whole block, it seems like, with a pizza place and a party room. Very nice place.
Very good.
So tell me, what can we do for you tonight?
About 10 days ago, I took Flonase because I felt congested. And I got such a smell in my nose, like a sweet smell, and I can't seem to shake it. And I went to the ear, nose, and throat, and he says he doesn't know really what it is, what this smell is coming from. But he said, I'll give you an antibiotic. So I don't know what to think.
Well, Dr. Mirastami, let's hear what he weighs in on this one.
Did you have an infection before or just congestion?
It was just congestion, sinus congestion.
Some of these nasal sprays, they have alcohol base, or the ingredient they use, it may not agree with some people, and they get a specific taste, and that takes a week or 10 days before it goes away. You may want to ask your doctor to give you a different kind of nasal spray.
Well, I stopped taking the Flonase, but he put me on Ceftin, the antibiotic.
Okay.
I don't know what that's going to do. Maybe I have sinusitis, but I'm just nervous about this smell, and it could be from the Flonase.
Well, as I mentioned, sometimes the base of the drug that is used to produce a drug, some have alcohol and some have other ingredient. So it may take a little while for the smell to go away. But infection could also give you that. So he's treating an infection at this time.
What about saline?
Saline is not really, it helps, but it's not really an anti-inflammatory medication that is needed for congestion and sinuses.
Okay, thank you very much.
Thanks a lot. We're going to go now to Walter, who may have an answer to the quiz. Hi, Walter.
Hello, doctor.
How are you doing tonight?
Very well.
Where are you calling us from?
Woodside, Queens, New York.
You've been out there a long time?
Yeah, we've been here about 30 years.
30 years. Is that near London? Not London Lenny's out there. What's out there?
Right near St. Sebastian Church and Donovan's Pub, a very good eating place, and Sri Prabhai, a very nice Thai restaurant.
Excellent, excellent. Good recommendations. Thank you. What can we do for you?
I believe I have the answer to the quiz.
Uh-oh, okay, let me get everybody lined up here. All right, we're ready. Who is the only person not to have been elected president or vice president who served as president?
I believe it's Gerald Ford.
He thinks it might be Gerald Ford. Is it Gerald Ford? Whoa. Walter.
Yes.
Did you know that one off the top of your head? You
I
used
did.
a little.
I did.
You didn't have to use any little.
No, I just watching the program and I heard you ask.
Remember, wasn't he elected? He was appointed vice president after Agnew.
Exactly right.
Yep.
Yes.
So he was neither elected president nor vice president directly.
Nixon got impeached.
Nixon, right.
Right.
Then
That's right.
It's amazing.
Well, Nixon resigned.
Right.
Yeah.
Did he get elected again, or he just ran the one? He just finished
One
out the
time.
He
term.
lost when
One
he
time.
stood for election against Jimmy Carter.
Are you a student of history?
More or less contemporary history more than
Very nice.
world history. Yes.
So you're going to get the plaque.
Thank you very much, Doc.
It's going to be heading to your house. You give the address to people.
We enjoy the program very much. Keep up the good work.
Okay, take care.
Thank you.
I have to. Again, I don't think Walt is getting this shirt. I think with this shirt, again, be proactive. Ask the doctor. It's a magnificent shirt. You're going to get comments from people all over the city when you wear this shirt. What do you think of that, Ron?
I think it's beautiful.
It's a really nice shirt, and for a donation of $60, it's cheap at half the price. No, so okay. Thank you. All right, so what we're going to do is, after all this excitement, we're going to take a little break now to give a chance to calm down, and when we come back, we're going to be meeting our doctors again, talking about foot problems, heart problems, lung problems, internal medicine problems. But I want to remind you about the NET survey. It's very important to fill out because the management is looking to see which shows are well liked and what suggestions that people have. And we know that our audience, a lot of them don't use the computer, so I want to stress the address. You have to write to NET at 1712 10th Avenue, Brooklyn, New York, 11215. I'm going to repeat it. NET, 1712 10th Avenue, Brooklyn, New York, 11215, and ask for this survey to be mailed to you. Demand it if they're not going to do it. And of course, you can participate online at the netny.net. And I know I get a lot of letters from you guys. This is a good time to get your opinion in to make sure that Ask the Doctor continues for another 15 seasons. So let's take a break now. When we come back, we'll be talking about foot, heart, lung, and internal medicine. Don't go too far. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are foot surgery, cardiology, lungs, and internal medicine, where we have Dr. Ronald Suave, Dr. Jeremiah Gellis, and Dr. Ramin Mirastami. Now let's get to the questions. We have Rosemarie on line 1. Hi, Rosemarie.
Hi, how are you, Doctor?
How you doing, Rosemarie? So for those who don't know, where you're calling us from?
Maspeth, New York.
Maspeth, New York.
Yes. And
So-
I had the answer, but no, somebody else wants
I know, Walter, he got that speed dial. I think a lot of people.
That's okay. I have 2 plaques already.
But what do you think about the T-shirt?
Oh, I like the T-shirt.
I like that shirt. I like
I really do like it, but I couldn't buy it this week.
Not this
but I'm
week.
going to get one of those.
We should have a layaway plan for Christmas.
I think that's a good idea.
We might have to do. I'm going to speak to the management.
Yeah, maybe you might have to do the layaway plan for me. No, I'm going to get a shirt. Don't you worry.
Okay. I want to. When I see you, I hope you're wearing it.
Yeah, if I ever see you.
Rosemary and I just keep missing one another.
I know, we do.
All right, that's the fate. That's fate.
Well, my question is about the white coat syndrome. Now, I want to know, is this a real thing or what? But I'll tell you what it is. I take my blood pressure.
Hello?
And,
No, it's okay. It's a party line. We're working on getting our own line soon.
and my blood pressure is great at home, like 117 over 70 or something like that. And now the minute I go into that doctor's office, it goes up.
Is that when you get your bill?
No,
No.
not even when I get the bill. Well, I used to work with doctors. I worked with doctors for 25 years, so I don't know if it's from working in a medical setting, you always think there's something wrong with you or what it is. But when I go into him, he believes me now because I brought the machine with me. So he knows my blood pressure isn't high only when I see his lovely face.
I want to ask Dr. Mirastami and Gellis and Swabi. Let's ask all three. What do you think? Is white coat syndrome a real syndrome?
Yes, I think it is. I've had, many patients over the course of many years that, they've taken the blood pressure, they come to the office, the blood pressure in a matter of 2-3 minutes goes sky high. So some of the patients that have done what I've done, I've given them a small dose of lorazepam, like an hour before coming. It does wonders for them.
I bet it does.
That's what I used to send to girls when they go out on a date with me. I used to send them a whole dose of lorazepam.
Oh, my goodness. Well, that sounds like a good idea.
Yeah. What about Dr. Gellis?
The white coat syndrome is a real phenomenon, and there have been many, many studies that have shown that the best way to monitor blood pressure is by ambulatory blood pressure monitoring. Right. It's a little bit annoying, and most insurances will not cover it.
Right.
But that is the best way. And I advise my patients to take their blood pressure at home if they feel that their blood pressure is normal at home and goes high in the office. But it's a very definitely a real phenomenon.
Great.
Ron?
I can believe so, but when you have a good doctor, when I see Dr. Mirastami, my blood pressure stays good.
That's
so
good.
hopefully.
You need the right doctor.
I need the right doctor.
So, Rosemary?
Okay.
All right. You know what I was thinking after hearing you? The viewers might be interested. Maybe send us a picture and a little profile, and we'll have a viewer of the week.
Oh, no.
We'll do a viewer of the week profile.
Maybe Pat. Pat's a good one.
Yeah, Pat, anyone who wants to send in a picture and a little profile, and we'll do a viewer of the week.
That would be nice. Good idea. Thank you, everybody.
Take care, Rosemary. Have a nice week. Talk to you next week.
You too. Bye.
All right, Maddie may have made it in. Hello?
Yeah.
Do you have any questions for the doctors?
How about the knees?
Maddie's got knee problem. Let's go. The foot is close.
Well, we could try. Yeah. What's your question, Maddie?
My question is, my head going to be all right after the operation?
Anyway, Maddie's got knee problems from previous shows.
Yeah.
And you wonder, is there a link if she has foot problems that could cause knee problem?
There are. Sometimes, believe it or not, I mean, it could be, it depends what the pathology is, Maddie, but if you have problems with your knees, sometimes the alignment in your feet does affect the way your knees, the alignment in your knees, and it could cause that. And sometimes orthopedic surgeons, when they have something like chondromalacia patella, which is a wearing of the kneecap, or sometimes even a meniscus problem, an alignment issue it doesn't correct the underlying pathology with the knee, but it kind of like relieves the strain in it. And sometimes we put orthotics in shoes just to align it to relieve the strain in it. So it helps relieve some of the
I want to throw a question in, though. A lot of women wearing these high heel shoes, and they're getting terrible pains under it, neuroma. Could you just talk quickly about what it is and what you can do? Maddie, this is another question. Take a listen to this.
Well, neuromas, for anybody out there, is a inflammation and a thickening of a nerve in the foot. It becomes very painful. And what happens is people tend to say that they feel like a knot or a ball in their foot, and it burns, and they have to take off the shoe, and they have to rub it. And it's very tender. Any nerve pain is always tender. And it's due to irritation. And sometimes what you do is treatment of this is one of the alteration of shoe gear is a very important factor, especially ladies with that a high heel and a thin sole shoe. They're putting all the pressure there. So we try to get a wider shoe so it doesn't compress. We're a little bit of a cushioning on the sole. And when that fails, you could try physical therapy, injection therapy. As we discussed earlier, you could try a local cortisone injection in the ear to reduce the inflammation. And there's other injections such as what we call sclerosing injections, which consist of alcohol. And basically what that's doing is desensitizing the nerve, the outer layer of the nerve, so it becomes less painful and so forth. And surgery is your last option with that condition. But it should be your last option.
Maddie, thanks a lot. Hope you have a nice week. I hope you hear from you next week. Okay, we'll go to Geraldine. Hi.
Hi, Dr. Garner. How are you?
Good. Where are you calling us from?
Bensonhurst.
Oh, what do you think of Sorrentina?
I've never been there.
I really like that place. I think it's on
11th
Avenue, right, about 74th Street.
I believe somewhere's around there.
And somebody was telling me also Mama Rosa?
I've never heard of that.
Mama Reyes.
Mama Reyes, yeah, I've heard of it. I know people who have gone and they said the food is very good.
Yeah, that's what I heard from a very reliable source, so I have to get in there. So do you have a lot of trick-or-treaters out there yesterday?
Well, I tell you the truth, I don't know because I was at the hospital from 5 o'clock in the morning.
Oh, what happened?
I had to go for an angiogram.
Wow. I got Dr. Gellis here. He's interested. What happened?
what happened? Well, that was my 6th time I had that done. I have 2 stents in one artery. Now, I had the angiogram yesterday, and the other 3 arteries are blocked. One is the main artery is blocked by 60%, and I have to go in 2 weeks for triple bypass, which I'm very scared of doing. Now,
Dr.
the thing is, I'm on Plavix for the last 3 years, because that's when I had the stent done. Will I be staying on Plavix after this surgery is over?
That will depend on your doctor. You can stay on Plavix, or you could just be on aspirin. Plavix is really needed for stents, and usually it's only used for 6 months to a year, or I would say at most 2 years after a stent, although some doctors will keep their patients on Plavix forever.
I see. And what do you think about going into, see, I live by myself. What do you think about going into rehab after leaving the hospital? What would they do for me there?
Well, I think it's going to depend a lot on how you feel. Some people don't need to go to rehab, and some people going to rehab for a couple of weeks helps them a lot recover from the surgery.
Do they do anything special in rehab?
No, they just sort of ambulate you in a gentle way, and they take care of you, and it depends on your home situation to some extent, but they help you out with the activities of daily living.
I see.
You know, meals and so on, making your bed, etc. So I think rehab is a good idea for a lot of people after surgery.
I see. Now, another fast question regarding this surgery. Do they take nerves from the leg to put into the arteries? I mean, do they take the arteries from the leg?
They don't take arteries from the legs. They will often take veins from the legs.
Oh, veins. But I have very bad varicose veins. Where would they get the veins from?
Well, they may have a problem in that case. They may have a problem. They may have to use what we call cryopreserved veins instead of using your own veins. Oftentimes, however, they can use for the bypass grafts the artery in your chest, what we call the internal mammary artery.
Okay.
So there's a number of options out there. So when is the big day?
November 16th.
November. So we'll hear from you again next week, I hope, and then after the surgery.
Yes, sir.
Good luck.
Thank you so kindly, and everybody does a great job.
Thanks a lot. Be well. Let's go now to Evan. Hi, Evan.
Hello.
Evan?
Yvonne?
Yes, how are you tonight?
I'm not bad, thank you.
And where are you calling us from?
I'm Brooklyn, New York.
Which part?
Midwood Sanctuary, Brooklyn.
Midwood. Could you just talk a little closer to the phone? What's your first
Midwood
name?
section of Brooklyn.
What's your first name?
Yvonne.
Yvonne. That's why I was getting Evan, and I heard a beautiful voice. It didn't sound like. Didn't sound like an Evan. Evan. Evan's my grandchild. So
my speech is not that great. I had a mild stroke, mostly speech-wise, so sometimes it affects me a lot.
I see. And what do you get out much in Midwood, or you're able to get outside?
Most times I go to the doctor sometimes, and I just started therapy for my knees. I'm going there now for the therapy for my knees because I had mitral valve replacement in 2004. I had a stroke in 2008, but a lot of complications. I have COPD. My doctor said I have sarcoidosis, and what I'm finding is I have fibromyalgia also, and I'm getting a lot of body cramps. At night I can't sleep. I sit down, I gotta get up and walk around the cramps. It's all over like Charlie horse on my leg, upper leg, on her breast. And
Let's see what Dr. Mirstami has to say about this. Now, she had mitral valve in 2004. Then she had a stroke several years later and severe COPD. And she's not sleeping at night. You're getting pains in the muscles, walking around. You're short of breath at night?
Yes, sometimes. I see the 4 pillows.
What are the medications you're taking?
I'm using Spiriva, Albuterol, Zoloft. I'm using Alvir.
Okay.
And what else?
Just
give me Symbol to today's Symbol to use. I don't know if it will help. Okay. I'm so scared of using these medications.
How often are you using your rescue inhaler, the albuterol or nebulizer, if you have?
Like twice a week. I'm using that.
Very good. So that's a good sign. That means, are you coughing at night?
No coughing, just wheezing sometimes.
Okay, so the COPD seems to be, based on the medication, appropriately treated.
Yeah.
But you also have to look at if you're taking any lipid-lowering medication. Are you taking any cholesterol medication?
No, they give me she said to use magnesium, and I'm using vitamin D, 2,000 milligrams.
Vitamin D, okay. Have you had any problem with the back, such as,
Yes, I have with scalp nerves. I have a low back pain. I'm using the Flector patch.
Okay, so the leg cramps could be related to the back problem that you have. It may be a disc disease that you have is causing it.
But doctor, it's all over the body. It's not just back. It's legs, my body, under my arm, my breast, and neck, all over. I'm getting the pain.
Okay. There's also Cymbalta seems to be a good medication because that has one of the indication for Cymbalta is chronic pain. So you may have to talk to your physician to adjust the medication, maybe give you a higher dose.
Sounds like you got to move on, so we hope you pursue that and give us a call back so we get a follow-up.
Thank you, sir. I really appreciate it.
Thank you. We're going to go to Debbie before we take a break. Hi, Debbie.
Hi.
Where are you calling us from?
Oh, hello, doctor. I'm calling from Bensonhurst, Brooklyn.
Oh, Bensonhurst.
Mm-hmm.
Are you going to weigh in on that Sorrentina, or that you don't like that place?
Actually, La Polina on Avenue O is very nice.
What's the, how would you spell that?
I'm not sure.
Because Dr. Suave, what's the name of it?
La Polina. Is that on Avenue O or something, right?
Right, it's on Avenue. It's very good Italian food.
Very
it's
good
like
place.
Very good, very good. Debbie, what do you think about our T-shirt?
The T-shirt?
Yeah.
Oh, it's lovely. I think it's great.
I want to stress there may be imitations out there, so be careful. Don't buy this on the outside.
No, I wouldn't do that. I wouldn't do that.
Like that?
It's very nice.
I like that a lot. It's a good job.
Yes.
So what can we do for you?
Well, what I'd like to know is I was diagnosed with multiple sclerosis about 9 years ago.
Okay.
And I also had a heart attack a few years later.
How old are you, Debbie?
53.
53.
Yes. And I had 2 stents put in. I had chest pain and blockages, so I ended up having 2 stents put in. So what I'd like to know about the interferon is the interferon doesn't help my spasming at night. It seems that my feet and I'm numb from the waist down.
Mm-hmm.
And I can walk. I wanted to know whether or not there is something out there that can help the spasming. I'm on Neurontin. Doesn't help really that much.
I'm going to ask Dr. Mirastami to start with the spasms, and then Dr. Gellis to just weigh in why such a young woman might have a heart attack.
Yeah, well, I don't have a very good family history, so I think that might be the reason.
Let's see what Dr. Mirastami says about the...
I'm sure you're being followed by a neurologist, correct?
Neurologist and a cardiologist. Okay. And New York Methodist is my hospital. Dr. Gelfish is my doctor. He's wonderful. And your panel, absolutely wonderful, and so is your show.
Thank you.
Well, as far as the spasm goes, it is not uncommon with MS. I think the best thing would be to follow with your neurologist because there are a lot of newer medication that are out that unfortunately I'm not familiar with.
Okay. Dr. Gellis?
Well, as far as the cardiology problem is concerned, I don't think it's related directly to the multiple sclerosis, and I know Dr. Gelfish very well. He's a very good friend of mine, and he's an excellent cardiologist. So you're in good hands as far as that's concerned. And I assume that your cholesterol is what it should be and your blood pressure is what it should be, and that the various factors that cause people to have hardening of the arteries are under control.
Well, my cholesterol is high. I'm on Crestor. My cholesterol is a little higher than Dr. Gelfish would like. And as for my blood pressure is really basically high, and I get out of breath a lot. So I constantly have shortness of breath. I actually spoke to him today because I have the same shortness of breath, but he might think it's anxiety as well. So.
Yeah, I guess all these factors, I think. It's a tough, it's a complicated case. I'm glad we had a chance to talk a little bit about it. We're having a neurologist on, I think, in a couple of weeks. So would you call into that show?
Yes, of course.
Very good. So, Debbie, have a nice week, and we'll talk to you later. Okay. So what we're going to do is we're going to take a short break, and then when we come back, we're going to go to the rapid fire. I call it rapid fire, where we're just going to answer one question after the other. We have so many callers on tap. So we have foot surgery, we have cardiology, we have internal medicine, pulmonary medicine, and a T-shirt. So don't go anywhere. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are foot surgery, cardiology, lungs, and internal medicine. Now we're going to go right away to Zoraida. Where's Zoraida waiting for us? She's on line 4. Hi, Zoraida.
Hi.
What would you say, Zorita or Zoraida?
Zoraida.
Zoraida. What kind of derivation? Where's that name from? Is it from any particular?
Trinidad.
Which one? Zoraida?
Trinidad.
Yeah, I couldn't quite hear.
Trinidad.
Trinidad. Very nice. Very nice. And you're calling us from which borough?
Queens, New York.
Queens, New York. Which neighborhood?
Jamaica.
Jamaica. Did you have a lot of trick-or-treaters out there?
That's the whole Queens is Trini.
Ah, very nice. So what costume did you see the most yesterday?
A lot of Trini flags.
Ah, very nice, very nice. I'm not sure what you're saying, but it sounds nice. So, what can we do for you?
Okay. I turned on my television tonight for the first time, and I saw your program. It's very interesting to me.
Thank you.
So with my vote, I think I would like you to be on the air, like you say, for the next season.
Oh, thank you. You got to fill out the survey. You did that?
Yes, I already have the address, and I'm going to vote for you all.
This is what we need, more people like Zoraida out there. Getting
Oh,
out
yes.
there. You sound like one of these developers, these community organists.
Well, I will definitely try to get organized more people for the program because it's very, very interested. Even though you don't have a problem, you listen to the television program and you learn from that.
You know, Zoraida, I'm very close to giving you this T-shirt, but let me hear a little
you
more.
throw it to me, I'll catch it. You just throw it to me and I'll catch it.
This is okay. So tell me, do you have? I hope you don't have a serious medical problem. Do you have something we could talk about?
No, I have my problem is that my 2 feet, it burns.
2 feet burn?
Yes, it burns. It burns like it feels hot.
Feels hot. Do you have any medical
Yes.
problems such as diabetes or thyroid?
I don't know if it's diabetes, but my mom had the same problem years ago. She died now.
Okay. So
After a while, she had gangrene, and she had her feet, one of her foot, she lose one of her legs.
So one of the things you're suffering, you have to rule out what's called neuropathy, which is affects the nerves, and there could be reasons for it. There's different reasons why you get burning. One could be it could just be coming from your back. If you have back problems such as sciatica and so forth, it would come from there. Other things you have to look for is there a reason for it metabolically, such as diabetes or thyroid, which these things could, because it's on both feet. It's not just on one, so you have to look at to see if there's a cause. And what I would do if I was you would be, I would go to your medical doctor, let him test you first to make sure you're not diabetic, test your thyroid, etc., and make sure there's no underlying reason for the thing, for the burning. If that comes out to be negative, then the next step to be, maybe neurologist or podiatrist coming in and then do a full neurologic workup to see if there's any nerve entrapment, something irritating the nerves.
Good. Hope that helps you.
Okay, thank you.
Okay, Zoraida, call back. We're going to go to Lisa now. Hi, Lisa.
Hello.
Hi, Lisa.
Hi, how are you?
Hi, where are you calling us from?
I'm calling from Brooklyn.
What part? What part of the...
I'm in Midwood.
Midwood area, not too far from Yvonne, it sounds like.
Right.
And do you like, what can we eat out in Midwood?
Well, believe it or not, I go to a Queen's restaurant. I love their food.
Which one do you like the best?
Chicken francaise.
Oh, chicken francaise.
I love it. It's delicious.
You know the place, Ron?
Which one was that? I didn't hear that.
Chicken francaise.
I know that's the name of the dish.
That's the dish.
That's the dish.
Oh, the name of the restaurant is Queen's.
Queen on Court Street?
Yes.
Oh, Queen is a great
Queen's
restaurant.
Great.
Oh,
I used to go to St. Francis College. I used to go there.
I meant Queen's restaurant, not Queensboro.
Gotcha.
Yes.
And it's delicious food. Prices are okay. And I used to work nearby, so that's how I got to know that place.
We love that place. Great
Yeah,
place.
I know, very good.
There's a nice diner up the block, too, going towards Brooklyn Bridge.
Which one?
A diner not too far from there.
No, I haven't been there.
We're going to have to go to rapid fire because we're backing up, but I thank you so much for the call.
Can I ask a question?
Oh, sure.
Okay. I happen to cough a lot. I don't have a cold, and I don't smoke. I never smoke. But I constantly cough. It's a dry cough, and I don't know what to do about it. I went for a lung x-ray, and it shows that I have a scar. And my doctor said maybe this is the reason. But my question to you people, what kind of medication can I use? Most of medication are a cough due to a cold, but I don't have a cold.
Right, so Dr. Mirastami, what's going on here?
Well, first question is, are you taking any medication?
I'm taking blood pressure.
What's the name of the blood pressure medication?
Metoprolol.
Metoprolol. Are you taking any other medications?
Baby aspirin.
That's
every
it?
other day.
Is that it?
That's it.
Okay. So generally speaking, the 95% of the coughs are caused by three mechanisms. Those are postnasal drip, acid reflux, and asthma. So when in doubt, you could ask your doctor to give you a 10 or 14 days of trial of medication that covers all these. So you need to see your doctor and discuss this with her.
Okay.
Hope that helps you.
Okay. Thank you so much. You're good, and I love your show.
Thanks, Anat. Have a nice week. Go to Brenda. Hi, Brenda.
Yes, hello.
Hi, talk a little louder, please, Brenda.
Yeah, my name is Brenda. I'm from Brooklyn, New York.
Which part?
Bedford-Stuyvesant.
Bedford-Stuyvesant. And we never find a restaurant. Have you found one out there?
No, not yet.
No, we're still looking. Everybody's looking. We have the whole patrol out there. But what can we do for you since we're...
Yeah, I have a bunion, and I have a surgery to be done on the 7th of December. And I need to know what's your option before I have the surgery done.
So for a bunion deformity, the main thing is it painful and is it getting larger? I mean, a bunion deformity will not kill you, so it's elective. Generally, when we do surgery on bunion deformities, therefore, ones that are becoming painful and larger. Your options include just wider shoes and paddings to corrective surgery. Now, corrective surgery depends on, one, your age, how bad the bunion is, because as the bunion gets worse, the surgery gets a little bit more in depth or a little bit more complicated. And if there's arthritis in the joint, that's another factor that determines what procedure it is. But generally what you do is you start off with conservative therapy, and that includes wider shoes, paddings, arch supports. If that fails, then you move to surgery to correct the bunion.
Yeah, because he told me the same thing. Use a little bit, use shoes that is not that tight. I does that, but then when I use shoes that is not that tight, I realize that the bunion is growing because it has more space to open.
Right, because what happens is the bunion is leaning on the nerve in the area, and the shoe is also leaning on the nerve. It's getting entrapped. It's getting caught between the bunion and the shoe. So if you're not interested in surgery, which is okay, all you have to do is get a wider shoe. You get an extra wide shoe to accommodate the bunion, and you should be fine.
So I hope that helps you.
But when I wear the wider shoes, will that bunion stop growing, or it will just continue growing as long as
it can continue growing? So that's why you have to monitor it, because if it gets bigger, you might need more of an advanced type surgery.
Thanks a lot for the call, Brenda.
Okay, you too. Thank you.
Be well. Let's go to Leslie now. Hi, Leslie. Leslie?
Yes.
Are you good? How are you doing tonight?
I'm doing very good, thank you.
Where are you calling us from?
I'm calling from Sheepshead Bay.
Oh, Sheepshead Bay. What was the scene like out there last night with the trick-or-treaters?
I didn't see not one child.
Not one. Amazing. In my
No.
neighborhood, thousands of people. Amazing.
Oh, my God.
Very, very good.
Good, good.
Yeah, so what can we do for you out there in Sheepshead Bay?
Well, yes, I have a question, doctor. About a month and a half ago, I was lifting weights. And then the next day, I started feeling pain in my right breast. A few weeks later, I went to see my doctor, and he told me that it was from lifting the weights that I had strained a muscle. Then 2 weeks later, again, I went to see him because the pain was still there. and he said to me that he wanted me to see a breast oncologist, Dr. Kehoe in Brooklyn.
Okay.
And I'm wondering whether I should worry about this.
How old are you?
I'm 45, and I had a mammogram in May, and it was normal.
That's good. Dr. Mirastami, then I want to say something.
Did you lift up something heavy?
Well, I was lifting weights. They were 10 pounds.
Okay. I mean, sometimes with the sudden movement of the arm and lifting object, you may have pulled a muscle or a ligament, and sometimes if you overdo it again, it just comes back. If you had a mammogram about a few months ago, I don't think that's an issue.
Leslie, what I would like to see you get is a sonogram. And that is non-invasive. There's no radiation involved. And we could see if you have what we call a hematoma, which is just a blood collection that you tore some muscle and it bled a little bit. So you can get the sonogram.
Okay.
Ask your doctor, okay?
Okay, thank you so much.
Okay, take care. We're now going to Julius. Hi, Julius.
Yes.
Julius, how are you tonight?
Very bad. Very lonely in particular. And
well, we're going to keep you company for a little while here.
Yeah, I'm physically incapacitated. I'm under 100% disability, service-connected.
Where are you calling us from?
I have all these problems, and they keep sending for me at the VA. I go there at least a dozen times a month. That's only because I'm able to consolidate a lot of my, appointments. And I can't hear too well.
What's your biggest problem?
There's several. My both feet, ankles, and calves are swollen. They've been swollen for 5 years, and they're all discolored. I have my kidneys are in the 4th stage. If they go into the 5th, I have to go on dialysis. 2 weeks ago, I went for an MRI. They had told me I had cirrhosis of the liver. I was in the paratroops. I jumped and hurt my back 60-some-odd years ago.
Which part of the Europe were you in?
In the Second World War, and I re-enlisted during the Korean War, but I didn't see any action in Korea. In the Second World War in Germany, I got a Purple Heart, Silver Star, and quite a few other medals.
What I'm going to have to do, because since we don't have the time to do it justice, we're going to address your issues at the beginning of the next show, next Tuesday night at 8 o'clock on the net. Okay? Thanks a lot. Larry.
Yeah.
Hi, Larry. How are you doing? Are you calling us from Chelsea?
No, I'm calling you from Brooklyn, New York.
Which
I have
part?
A question. Bensonhurst.
Bensonhurst. And what's your question?
My question is for the heart doctor.
Okay, Dr. Gellis.
Dr. Gellis, yes. I had tachycardia, and I had the ablation of the heart done. Symptoms seemed to regress for a few years, then started to come back, the fluttering in the heart, the irregular heartbeat. Then the doctor put me on a Tetanol. It seemed to calm down again, and now it seems to be acting up again.
Okay, what's the question?
The question is, what can I do for this irregular heart rhythm? Because if it lasts for a couple of days before it subsides,
okay, Dr. Gellis.
I get very weak.
Because we don't have much time, I wanted Dr. Gellis to get his answer.
Did you have an ablation?
Yes.
Well, ablations work the first time around about 90% of the time. Very frequently, at least 10% of the time, depending on who's doing the ablation has to be repeated. So the first question is whether you need to have a repeat ablation since they've already done one. Mm-hmm. Have you discussed that with your doctor? Has your doctor discussed it with you?
No. The last thing I did was go on the Tetanol. Seemed to calm it down quite a bit.
Larry, what I'm going to have to do, I'm really sorry to cut this off in the middle, but we're only paid up until 9 o'clock. So next week we have another cardiologist on. Get the information from your doctor.
You need to talk to your doctor about this issue.
Thanks so much, Larry. We appreciate the call. And I mean, we had so many people left to talk to, but that's it. The clock ran out on us. I want to thank Dr. Ronald Suave, Dr. Jeremiah Gellis, Dr. Mirastami for coming in. And we hope we've been able to help you. Remember, it's good to remember to be proactive about your health. Speak to your doctors about your concerns. Go for second, third opinions, much like Dr. Gellis just asked tonight. Again, our website, netny.net/askthedoctor. I want you to look at the tablet, which we have a weekly column. But on the website, if you missed the tablet, you can watch podcasts, the forum, email your questions in advance, and participate in our viewer survey. I want to thank those who participated. Thank you to Linda Lapatosa, our quizmaster, and thank you for all your questions. Also, tune in tonight at 10 o'clock for the encore presentation of last week's show. And this, who can leave without mentioning this again? I mean, this is something I understand like Home Shopping Network. We have like 3 left, so get your calls in fast. Goodbye. See you in the tablet.